Thank you for joining me, Dr. Christopher, and congratulations on your extraordinarily successful and impactful tenure as chair of the board of directors of Trust for America's Health. We truly thank you for your remarkable leadership and service to the organization. You know, it must be extremely gratifying to see the growth of TFAH over so many years and the impact we've made during your tenure as chair of the board of directors. What are some of the highlights for you, and to what do you attribute that success?
There have been so many amazing things that TFAH's leadership, and that I think is one of the most important things to consider, is the quality of the leadership and the staff of this amazing organization. You've accomplished so much over the years and been prescient in terms of what are the priority issues for our nation's health. I'm going to start with, the decision to produce reports on an annual basis that speak to the preparedness of our country to respond to an emergency and to a crisis. And over those many reports, so much guidance was given, so much insight, so that when we encountered this tremendous crisis of COVID-19, this organization had the respect and the authority, and people turned to this organization for leadership, for innovation, for guidance as to how do we prepare ourselves in the midst of a crisis to have a more equitable and effective response. So I think our emergency preparedness work was very important. Another highlight for me has been our ability to step into the tough spaces, right? This country has been burdened with an epidemic of childhood and, for that matter, adult population obesity. And this organization stepped into that with the support of the Robert Wood Johnson Foundation to begin to document the severity of the problem and to propose solutions and to evolve to a point where equity was centered in that, and the inequities and the disparities were lifted up, and the necessity of strategic methods and a strategy to address those inequities has been incorporated into that work and has been tremendously influential, not only at the national level, but also across the country. I think that is another highlight for me. And of course, the role that this organization has played in preparing and brief a blueprint for incoming administrations in terms of the health and the well-being of the nation. We've been there for every incoming administration, regardless of party. And it's just been an honor to be part and to be with an organization that has as its raison d'etre the true health of the country. Long before, we were so divided as a country, and through our divisions, this organization stands right at the center of saying we must work together to improve and optimize the health of our nation. And to me, the way that we work is as important as what we've accomplished in partnership. The fact that we work in this I'll just say nonpartisan way, the fact that we work in partnership and in coalition with so many organizations. So I think a highlight is as much how we work as it is the impact and what we've accomplished.
What are some of the foundational health policy issues that you believe TFAH and similar organizations such as ours should be addressing and focusing on going forward?
That's a powerful question, and it's the one question that gives me a little pause in terms of my sadness about leaving this organization and this role, but because the work remains, right? But I would say clearly that we must continue to shift the public discourse to a deeper understanding of, I would even say, the primacy of well-being and disease prevention. We're still looking at single-digit investments in terms of the millions and billions of dollars as compared to as a proportion of the broader healthcare budget in this country. And so we've got to get our country to understand that we must pay more attention to creating the conditions and investing in strategies to create the conditions that will optimize the opportunity for people to be healthy. and to experience well-being. And so that's broader social determinants context. We've got to figure out more strategic ways to not only invest there, but to track and document the effectiveness of those investments so that that strategy becomes the norm and not the stepchild, of our national investments for health and well-being. We also have to understand that the way the climate is changing, that it is a health issue. And I think there's more room for us to step into that space and document and articulate. As a research and advocacy organization, TFAH has done so much to lift up those issues that are threatening the health of not only our people, but the health of our democracy. And I listed a few highlights. I didn't talk about our pioneering work on our Pain in the Nation series and our pioneering work on the opioid crisis that has really saved, I believe, millions of lives ultimately. And so we have to do that same work in terms of connecting the dots for people to understand how the crisis of the rapidly changing climate and the disaster effects are having a disproportionate impact upon communities that have been traditionally marginalized. And we have to do more. It wraps back to the prevention conversation. We have to do more. So prevention for us now becomes disaster mitigation, right? And so we have to evolve with the realities that we're facing, to name a few of the challenges.
During your time as vice president at the W. Kellogg Foundation, you conceptualized and launched the Kellogg Foundation's Truth, Racial Healing, and Transformation Initiative. Can you describe the underpinnings of that initiative and talk about what our country needs to do to truly achieve racial healing?
That is a powerful question. Thank you so much for it. This country was conceived, in slavery, in the protracted centuries of enslavement. It was also conceived in the violence and the decimation of the indigenous communities of this country. And the permission to do that, to perpetuate that violence and cruelty and to sustain it for centuries was rooted in a belief system, a cultural ethos that I describe as a hierarchy of human value, an embedded cultural permission to devalue human beings based on their physical characteristics, superficial physical characteristics, or their countries of origin. And so this unspoken lie, has undergirded our society and stood as a barrier to us facing the consequences of those centuries of denial of the humanity of so many diverse people. And so the work of dealing with that is the work, I believe, of this century. It is our work. And there is a direct through line between denial of opportunity within our democracy and disproportionate disease outcomes, if you will, disproportionate burdens of chronic disease. And so it is critically important that our country do the work that over 40 other countries have attempted to do. It's called truth and reconciliation when you look at examples from around the world. And we really had those as our guiding light, if you will. But we know that for a country like ours, which is so unique in the entrenched nature and the entrenched nature of denial of the truth of our history, that we needed to do more than a temporary commission that might create opportunities for catharsis and for truth-telling, that we needed to embed that experience in a broader strategic context, a broader strategy for transformation. And so truth, racial healing, and transformation is a 5-part framework that is definitely designed to undergird ongoing work to lift up the multiple dynamics of our history. It's not all violence and horror. It is also tremendous resilience, tremendous cooperation across racial lines, tremendous victories. But we need to tell those stories, and we need to create a collective narrative of our country, I believe, that incorporates that past, and not in a way that it polarizes and divides us, in a way that pulls us together. And that's where the healing part comes in. The second part of the framework after narrative change is what we call racial healing and relationship building. And there's so much power in relationship. As human beings, we are two-legged mammals, and we come into this world through others and with others, and our primary need to remain connected to and with others is part of what makes us human. I really encourage people to read the book by our current Surgeon General, Vivek Murthy, Together, which provides so much of the evidence and the research behind the primacy of connection and connectedness. So the racial healing work is a deliberate attempt to bring people of different perspectives and races, and identities together to begin to connect at a deep level and and learn how to develop the skills and the capacities for perspective taking, for compassionate engagement, so that we see ourselves in one another. And that work of stories and connection, it provides the healthy context for doing the work on the structural issues and the policy issues that are so important to the viability, not only of communities and their health, but to the viability of our democracy. And the three pillars left of this 5-part framework, they speak to the embedded nature of structural racism and structural barriers to equal opportunity. We asked ourselves, well, we know that this concept of a hierarchy of human value it's a false ideology left over from the 18th, and 17th century. How has it lasted for all of these centuries? And one of the vehicles for doing that is through separation. And separation takes myriad forms. Redlining and segregation is just one of them. But, our cradle to prison pipeline, our school segregation, the list goes on and on. So separation is a way to maintain the fallacy of racial hierarchy. So we have to look at that honestly, look at the evidence of the harm that has caused, and design interventions to mitigate and ameliorate the effects of that protracted adherence to separation. And then we know we have a set of laws and policies that our governance structure was also informed by this fallacy of a belief in a hierarchy of humanity. And so in so many different aspects of our policies, governance, and legal system, we have to address that, not to the least of which is everyone having access to voting rights, access to the right to vote, access to their vote being counted. And so voting, immigration policy, our criminal justice system, those are just some of the many ways in which our laws and policies must be revisited in light of a willingness to redress the legacy of belief in racial hierarchy. And then finally, our economy. Our society represents right now expanding divides in terms of wealth and access to economic opportunity. And that too is a carryover. It's part of a through line of the history of the inception of this country and the centuries that we put in place economic systems, enslavement being one and the stealing of lands being another. And so, it's time for, I believe, America to grow up and own that and address it with a spirit of the future in mind, that we're still evolving as a democracy.
The COVID-19 pandemic, it has starkly illuminated and also exacerbated longstanding racial and health inequities in the US. Will the pandemic's tragic toll, will it drive change?
Well, I certainly hope so. And not only am I hopeful, but I also see evidence of the willingness for that change to happen. This is a rare moment. I jokingly say there's some advantages to growing older. None of them are physical, but you do get a chance to look back and have some perspective in terms of where we were versus where we are now. And there is a genuine movement in the field of public health, and I believe in all aspects of our health system. There's a genuine outrage at the disparities and the inequitable costs that you just described. And there's a genuine effort to address that, to identify it, one of which is the Commission to Transform Public Health Data Systems that I was honored to chair. Robert Wood Johnson funded that. And, you know, we came up with a set of recommendations that will center equity in our approaches to data and to data modernization. We have to recognize that how we've been doing and collecting and disseminating data was not adequate, you know, and it did not either reveal the vulnerability or give us indications as to how to mitigate that vulnerability for diverse communities. And so, but we can do better. You know, we have the tools now in the 21st century. We can collect data, we can engage more authentic community voices in the collecting and the ownership of that information and data. And we can do so in a much more rapid and real-time basis so that we know what's happening in communities as it is happening. And we disaggregate that data so that it is giving us a true picture of the vulnerability, the resilience, the needs, the resources. So I'm hopeful that epidemiological, you know, data foundation of our field will be transformed as a result of the pandemic and the stark, painful reality of the inequities. And I think if you look back in history, all pandemics have led to major innovations. And I'm sensing, and I'm really hopeful that it's going to open up a watershed moment for innovation in terms of public health. But I do want to remind us that it's within public health where we need the innovation. You know, we had innovation in terms of the medical intervention and the vaccinations, and that was brilliant and wonderful and a direct outgrowth of the last, if not pandemic, maybe even pandemic of HIV/AIDS. We learned so much about the genome and our immune system. And I think that informed our capacity to develop vaccines so rapidly. But we also have to take that innovative spirit into the broader world of social determinants, the broader world of economic and political determinants of health and well-being, and actually develop strategies to change the conditions in which people live so as to reduce the vulnerability and help communities to mitigate the risks that are with us now. We're going to have pandemics, you know, we have climate change. And so this ability to shore up the resilience of communities, it's absolutely a necessary focus going forward.
So many things that we could continue to ask you. Is there any other guidance, advice, or closing thoughts that you would like to share with us?
You know, the only thought is appreciation. It's not just a thought, it's a set of feelings as well. We have been so blessed, those of us on the board, us in that level of leadership of this organization, to have hired you, to have hired your predecessor, to have been able to support a leadership, an executive leadership team that is just unparalleled, I believe, in terms of that inner wisdom that understands the spirit of this organization, that we are, in fact, a nonpartisan organization that has the gift of being able to identify, to define, and to advocate for and leverage resources and movement around the critical issues that are affecting the health of this nation. And so I'm appreciative of the opportunity to have worked in a leadership role for this organization for as long as I have. And I'm just so excited about the next steps for this organization because it is strong and it will continue to have authority and to be well respected, you know, in the field and across the nation. So my only final thoughts are thoughts of appreciation.
Thank you, Dr. Christopher, for those generous words. I will say that words will not suffice to really express the depth of our gratitude for your leadership and service. but let me endeavor to do so. On behalf of Trust for America's Health and our many partners, I thank you. Thank you for your visionary and exemplary leadership of and commitment to TFAH. You've just created a noteworthy legacy on the influence and impact of our organization. You've helped us to elevate our mission on prevention and public health and health equity to truly new heights. And we wish you all the best in your continued roles. And we know you're continuing as Executive Director of the National Collaborative for Health Equity. And we're looking forward to this next chapter, as you described it, of promoting optimal health for every person and community. The work lies ahead for us, but as you shared, as we think about the lessons learned of the pandemic, as we think about really the call for action to advance racial and health equity, the clarion call for action is clear. And so we thank you for providing that visionary leadership, enabling us to continue to move forward. Thank you and all the best.
To my honor. Thank you.